يعطيكم العافية. long day I know. I know. بس إن شاء الله عندنا الحين two lectures خفيفات ونخلص بإذن الله. still remaining two lectures or two topics و we will be done. يعطيكم العافية جميعا. So a third topic today with me, problems with surveillance. حكينا عن أهمية السيرفيلانس، دوره في تحسين تجربة المريض بالمستشفى، دوره في أمان بيئة العمل، دوره في جودة مخرجات الخدمات الطبية أو الصحية. مهم نعرف هذه التول الأساسية أو المهمة جدا. طبعا وغيرها في أدوار أخرى للسيرفيلانس ما حصرتها كلها الآن، لكني متأكدة إني غطيتها في الباوربوينتس. في ناس سألوا عن الباوربوينتس يحتاجونها، إن شاء الله نرسلها للمنسقين وتنزل في قناة الأكاديمية على ما أظن في الغالب يعني. فموضوع البرزنتيشن بسيط بإذن الله، حنرسله في الأخير. and لو سمحتوا please most of you ولا كلكم ولا الأغلب يقيم المحاضرات عفوا يقيمهم في البولز عندكم في البارز. تقييم يفيدنا صراحة، إحنا كسبيكرز نعرف نقاط ضعفنا نقاط قوتنا، نعرف كيف نخلي تجربتكم معانا next time أفضل بإذن الله. طيب ف بليز سووا التقييم على السبيكرز اليوم وإن شاء الله توصلنا حين نتائج، وشكرا لكم على وقتكم يعني في التقييم، شكرا كثير. So the problems with the surveillance. إذا عرفنا surveillance as a tool مهمة زي ما قلت لكم بالبداية، لازم نعرف إيش المشاكل اللي ممكن تواجهني أثناء يعني شو يسمونه creating السيرفيلانس بروجرام حقي في المنشأة اللي أنا شغالة فيها. So مهم جدا إن احنا نعرف المشاكل المصاحبة لبرنامج المراقبة للأمراض المعدية أو العدوى المصاحبة للمنشآت الصحية في المستشفيات، أوكي، أو في المنشآت الصحية بشكل عام. So in what I want to say إنه problems with the surveillance as we mentioned earlier today, with the purpose of the surveillance, the importance and benefits, it helps with the better outcomes and the patient safety, better safe environment for healthcare workers. The role of the surveillance, you know, in antimicrobial stewardship, MDROs, resistance patterns, follow up, outbreak management, support, a lot of things that I have mentioned today related to the importance of the surveillance. So from that, we need to know what are the problems that are related to the surveillance, and how can we overcome these problems so we can get the best benefits or the maximum benefits from this tool, and how to make this surveillance effective, right? So من هنا, from this we can start this topic. Outline will be healthcare associated infection surveillance standards, because from the surveillance standards, what is essential, what is important, what is critical, what is mandatory مثلا كستاندرد في surveillance, we need to know these standards, because breaking these standards is the problem, isn't it? فلما ما نطبق أي من ستاندرد للسيرفيلانس أكيد حنكون في مشكلة يعني مع السيرفيلانس نفسه، صح ولا لا؟ ف we should know the surveillance standards أول شيء علشان نعرف نقيض الستاندردز يعتبر إيش؟ problem أكيد، ويعتبر خلل في استعمال السيرفيلانس عفوا as a tool. من أهم الستاندردز في السيرفيلانس بروجرام هو الإيفالويشن للسيرفيلانس نفسه، لأنه مش مهم بس إن أنت تجمع الداتا ويكون عندك very huge amount of data. طيب إيش تعمل بهذه الداتا؟ analyzing الداتا، الانتربريتيشن في الداتا، الرياكشن، الأكشن بلان، الفولو أب charts، كل هذه هي مهمة بعد. الكوميونيكيشن اصلا، توصيل المعلومات اللي حصلت انا عليها في السيرفيلانس للاند يوزرز ولا الستوك هولدرز ولا الديبارتمنتس that are involved with me. هنا الفائده، هنا الامبورتنس تجي لل surveillance program، صح ولا لا؟ فالايفالويشن process is quite important في موضوع السيرفيلانس program. and لما يصير في الايفالويشن gaps ولا خلل أو let's say weakness, the whole thing is not working. ما راح نستفيد من هذا surveillance program, right? Effectively يعني to the maximum ما راح نستفيد نهائيا. and surveillance reporting نقطة مرة مهمة يعني beside the evaluation. The other point is reporting. طيب أنا عندي surveillance وديتا وعندي معلومات وعندي analysis وعندي charts وعندي tables وعندي، بس I haven't shared this data in the committee, infection control committee مثلا. I haven't sent reports to the مثلا ال higher administration level، ولا ناقشتهم في ال outcome ولا طرحت الموضوع. ف it's useless data، صح ولا لا؟ فالريبورتينج والايفالويشن هي من أهم الستاندردز في السيرفيلانس، طبعا بالإضافة لأشياء كثيرة في النص حنجيها اللي هي كيف الداتا to be collected, how the data to be collected, and um, how مثلا we unify الفورمز أساسا حقت الداتا collected. عشان إيش؟ collection عشان نكون موحدين طريقة جمع الداتا، ما يكون في اختلاف من وورد لوورد، من اي سي يو لاي سي يو، من هوسبيتال لهوسبيتال. لا ابدا، اليونيفورم لازم يكون موحد، او الفورمات تكون موحده، يونيفايد فورمات approved from الجي دي اي بي سي، المديريه العامه لمكافحه العدوى. This is what we should follow. And finally, we will cover some of the challenges of healthcare associated surveillance program. في challenges معينة مهما سوينا كل الخطوات، whatever we have done ولا accomplished مثلا، still these challenges are faced. يعني في خلال مسيرتي أنا شفتها كثير، من البداية للنهاية أنا شفتها كثير. it's always there، هذه obstacles أو challenges. And being aware of these challenges is kind of mitigate the problem itself, isn't it? يعني إذا عرفنا التحديات اللي تواجهنا في السيرفيلانس بروجرام، ممكن إن إحنا يعني نتعامل مع التحديات هذه بتلطيف معين وتقبل الطرف الآخر اللي معانا في موضوع السيرفيلانس بروجكت، لأن فيها أقسام أخرى داخلة في القصة. يعني it's about مثلا السيرجنز، الجراحين مثلا، العمليات اللي فيها SSI عالي للجراح الفلاني أو للثياتر الفلانية، أو مثلا for this hospital، كلها ممكن يعني تأثر على الريبتيشن للشخص، صح ولا لا؟ فشوي موضوع السيرفيلانس يحتاج مصداقية، يحتاج يعني transparency، يحتاج شفافية، ويحتاج قبول وميتيجيشن between الستوك هولدرز، between كل الأقسام والديبارتمنتس اللي they share الريسكس والديتا والاوتكم والفولو اب والريبورت etc. Okay, hopefully this مقدمة is clear. I know إني تكلمت عربي وإنجليزي كثير. Okay, hopefully the non-Arab people are okay with my Arabic, okay? And if you feel not understand by my words, let me know, okay? But the whole presentation is written in English though. Again, a short refreshment على healthcare associated infections من الEPIC chapter. This picture is quite cute. It says healthcare associated infections are a result of germs entering your body during إيش؟ medical care, as we said. وفي هنا عندي 4 نماذج للmost common, as I said before, اللي هي surgical site infection والنيمونيا والكاوتي and bloodstream infection. ما راح أقرأهم، بس this is a nice يعني cute picture. Healthcare associated infection surveillance standards. So first we have to go through the standards, and please guys, from these standards you will know if you break any of these, this is a surveillance problem. This can reach you and lead to a surveillance problem. Okay, so that's the the key from these standards being in this topic. So there are written policy and procedures for surveillance of healthcare-associated infections using CDC, NHSN, MOH definitions as a reference. So as a standard, we need to have a unified references احنا متفقين عليها تمام as a مرجع لنا في موضوع policy with procedure. So the policy and procedures need to be written from this defined resources. Please ما حد يجيب شيء من مكان ثاني. Right? عشان الكل يكون في نفس الصفحة. Okay. The hospital is using updated surveillance forms approved by GDIPC اللي هي المديرية العامة لمكافحة العدوى والوقاية منها. Right? تبع وزارة الصحة. طب الفورمز it should be updated and approved من ال GDIPC. There are enough number of well-trained infection control practitioners responsible for surveillance according to the hospital bed capacity. زي ما قلنا infection control team ولا infection control personnel ratio is very important. صح ولا لا؟ and مقابل كل سرير there should be a certain number of ICPs. مقابل كل 100 regular bed, every 100 regular bed, there should be one ICP for the surveillance data collecting, analysis, etc. Right? So they have to be in a good ratio, they have to be well trained and responsible for the surveillance. According to the bed capacity to the hospital. Number 4, there is a clear surveillance process. There should be a clear surveillance process involving other departments. زي ما قلت لكم الستيك بالسرفيلنس أقسام معينة معانا. They are microbiology logbook مثلا اللي هي report daily report of microbiology اللي يطلع لنا فيه all the positive samples, right? هذا يدخل معانا بالسرفيلنس ICU data OR team علشان السيرجري cases وعشان إيش؟ نتابع موضوع ال SSI. برضو أي any ward, any inpatient unit that has patient with device associated, صح? With medical device عفوا. Medical device such as catheter, يعني Foley's catheter, urinary, blood, central line, ventilator, right? So all these departments, stakeholders, they should have a clear surveillance process plan. They are knowing about it and it's familiar to them, right? Number 5, hospital surveillance data is validated. هذه الداتا لازم يكون لها validation. Okay, to avoid يعني bias والمحاباة والأشياء الأخرى لازم تقيم هذه الداتا. This data should be validated. مثلا, for example, number of event per type of infection, patients days, device days, number of surgeries اللي have been done. هذا كله لازم يكون له validation within the system. مثلا manually ولا systemically, it should be all validated. Number 6, results of surveillance are regularly analyzed, interpreted, and communicated to all the staff and concerned department, right? So زي ما قلت لكم, the stakeholders department, they have to know the reports. We have to share the reports with them and analyze this data together and come up with an action plan, right? With best interpretation to this action plan after this analysis. Then we can communicate the results وبعدين we can follow up the action plan ونشوف وين وصلنا مع action plan. Are we improving? Are we going up with the rates? Are we going down with the rates? Is it working or not? So if not, we have to change the action plan, etc. كله يكون عن طريق multidisciplinary teams, an infection control committee, all stakeholders, departments, etc. Right? طيب. Number 7, results of surveillance are regularly reviewed by the infection control committee and an action plan is developed and follow up زي ما قلت لكم accordingly if needed at least once quarterly. طبعا الانفكشن كنترول committee should be done على الأقل once quarterly or upon need. يعني ممكن يتعمل أكثر من مرتين بالثلاث شهور depend on the need. للcall for the committee. بس المهم, the more important thing is that we need to review this data in the committee with the stakeholders. Also the action plan لازم تنحط في البرزنتيشن لكل الأقسام الأخرى ونتناقش فيها. Responsible person with timeline والaction to be taken, or what is the standard, what is the ratio. هذا كله لازم يكون واضح في الأكشن plan. And this action plan should be followed. لازم يكون لها متابعة وتدقيق وإعادة رفع التقارير مرة أخرى. طيب رقم 8, there are improvement projects done after reviewing surveillance results. Improving projects زي مثلا KPIs أو مثلا زي zero collapse rate in PQ مثلا in PICU مثلا. هذه البروجكتس اللي لها أهداف معينة ممكن تكون موجودة ومفعلة من الداتا surveillance بعد الريفيوينج للresults. Number 9, patient care bundles are applied and documented in files of all patients under surveillance. مهمة جدا الكلابسي والكاوتي والفاب والVAE والSSI والdialysis event. كل هذه الكير bundles لازم تكون كدوكيمنت موجودة في البيشنت فايل and being followed on a daily basis. عفوا on a weekly basis من infection control team, بس daily basis from the nursing and respiratory therapist team. Number 10, staff providing care for the patient under surveillance are well trained. ضروري جدا. And familiar with all patient care bundle elements for prevention of the infection. هذا كله من الستاندردز. من الأشياء, one of the things that is kind of obstacle or مثلا let's say مو obstacle قد ما إنه يلخبط confusing is active surveillance versus passive surveillance. ففي surveillance active من أنواع surveillance إنه يسمى active, وفي من أنواع surveillance I believe يمكن زميلتي سمية أعطتكم إياه الصباح. Maybe my colleague سمية mentioned that in the morning session إنه في active surveillance وفي passive surveillance. إيش الفرق بينهم؟ What are the differences? Active surveillance يحتاج trained personnel. It needs a trained personnel. Mainly ICP اللي يسويه اللي هو infection control personnel, and it's strongly looked for healthcare associated infection. يعني عادة يكون targeted surveillance type and very clear and trained person to be done, mainly بيكون ممارس مكافحة العدوى اللي يسويه. Information accumulated by using a variety of data sources within and beyond the nursing ward. يعني ممكن إنه يكون في data collection مثلا من الميديكال records مثلا, مش من النيرسينج ستيشن, مش من البيشنت فايل مثلا. ممكن تكون data قديمة, data جديدة. فالinfection control staff بيكون المسؤول عن جمع هذه المعلومات من مصادر مختلفة كثيرة, مش فقط من التمريض. بينما passive surveillance, persons who do this surveillance are not have any primary surveillance role أساساً, such as a ward nurse مثلا or a respiratory therapist. Usually they identify and report healthcare associated infections whenever they notice it. For the part of evaluation of surveillance program, مهم نعرف the type of the evaluations. So if we understand the type of evaluation للsurveillance program, we can know when to dismiss the function of this evaluation and to prevent dismiss this function. Okay, so program evaluation is a systemic method. فهي طريقة يعني بنظام وسيستم method for collecting, analyzing, and using this information to answer questions about projects, policies, and programs, particularly about their effectiveness and efficiency. So evaluation دائما يركز على الفعالية والأداء, جودة الأداء ومدى فاعلية هذا البروجكت أو هذا النوع من المراقبة والsurveillance. So the type of evaluation, there are several types of evaluation that can be conducted. Some of them include the following. First, تقريبا عندنا 4. First is the formative evaluation, وهذا يعتبر ensures that a program or program activity is visible, appropriate, and acceptable before it is fully implemented بطريقة رسمية. Formative evaluation. It is usually conducted when a new program, يعني هذا مثال على formative evaluation. Usually we use formative evaluation على إيش؟ When we conduct a new program or activity is being developed, or when an existing one is being adapted or modified. في هالحالة نستعمل formative evaluation. Second type is the process implementation evaluation, وهذا determines whether the program activities have been implemented as intended or not. من اسمه تقريبا يعني واضح. يعني all the names are related to the function of these evaluation methods. يعني process evaluation, it focuses on the implementation. هل البروسيس this project had implemented the intent need of this project or no؟ بهالطريقة. نجي number 3 outcome effectiveness evaluation اللي هي المخرجات. جودة المخرجات أو تقييم جودة المخرجات. Measures the program effects in the target population by assessing the progress in the outcome or outcome objectives that the program is achieved. يعني أننا نقارن المخرجات أو الميجرز المساعدة للبروجرس لهذه المخرجات، لتطور هذه المخرجات، كلها related للمخرجات وفاعليتها. Okay, number 4 impact evaluation assesses the program effectiveness. من اسمه impact يعني effectiveness in achieving its ultimate goal. هل احنا حققنا الجولز من هذا البروجكت؟ هذا يسمونه impact evaluation. في الأخير بنقول yes or no, right? So برضو من الأشياء المهمة بالevaluation of surveillance program is outcome evaluation of surveillance activities. How can we measure the outcome in the surveillance activities؟ أمثلة حطيت عشان بس تفهمون أقرب الصورة. مثلا infection control indicators. What are the infection control indicators outcome؟ اللي هي الريتس المعدلات, right? Central line associated bloodstream infection rate, that's an indicator. صح ولا لا؟ أنا من الريت أقدر أعرف الأوتكم حق السيرفيلانس activity حقي. If we have, let's say, implement الكير بندل للكلابسي very well, أكيد بيصير الريت حق الكلابسي أقل. Of course, the rate of the CLABSI be reduced, isn't it? So those are indicators that reflecting the outcome حقتي للsurveillance activity اللي أنا سويتها. إن شاء الله يكون شرحي واضح. Surgical site infection rate برضو يعتبر indicator. It's also an indicator. Hand hygiene compliance rate برضو يعتبر indicator. Multi-drug resistant organisms rate. That is also an outcome infection control indicator. Other common measures. في measures أخرى common ومهمة. ريتات ثانية مهمة في السيرفيلانس. على الأقل في قاعدة البيانات للسيرفيلانس حقتي، خاصة أول ما نبدأ السيرفيلانس. There are other common measures that are really important and crucial, especially in the foundation of the surveillance program. ولها علاقة, it has related with مثلا house surveillance. يعني let's say we are taking all the data of the institution, healthcare مثلا, or we are specified targeted surveillance مثلا ICU surveillance مثلا only. That's a targeted one. ولا household surveillance. هذه كلها, these are all helping in the evaluation اللي هي ال other common measures. What are they? Rates before and after starting the surveillance. يعني زي الصورة الكبيرة. Like a wide picture. The widest picture you can picture a surveillance to the facility with is the rates before and after starting your surveillance. that's a مؤشر. Rates before and after applying bundles, care bundles, right? Rates before and after improvement projects. هذه كلها common measures, other common measures to share. Impact measures. There are impact measures that actually changes the rates dramatically, in fact, such as hospital length of stay, ICU length of stay. هذه كلها risk factors. Cost per administration in different departments, cost per event in ICUs, and attributable mortality. Those are really impact measures. They can change dramatically the surveillance rates in the facility. After the evaluation, it is important to understand the reporting system for the surveillance data that we have collected. والحين we are collected, we evaluated, everything. Now we need to report it. I'm taking only the most important elements in the surveillance or problems in the surveillance. So surveillance reporting, surveillance report is a written report should be developed to provide a mechanism to interpret and disseminate surveillance data على الستوكهولدرز اللي قلناهم. Tables, graphs, charts are effective tools for organizing, summarizing, and visually displaying this data and should be used as applicable, right? The format and the level of details in each report will depend on the intended audience. Intended audience يعني مثلا we have to show PICU staff the PICU data, for example, what they relate to, what is important to them. We don't have to show very, very complicated KPI مثلا let's say analyzing charts or tables or graphs to everyone else. They need the simple معادلات, simple rates to understand the thing. They are not infection control team or statistical team. They need the outcome of this report. We need to make it clear, unified, simple, and targeted for those whom are the stockholder. And remember, surveillance is not finished until dissemination of the surveillance report. So if you've done the whole steps at the beginning without reporting, meaning your surveillance is not useful. Finally, the challenges of healthcare-associated infection surveillance. What are the challenges that we usually face during collecting the data, surveillance report, or evaluation even? Some resistance to participate and collect the data of the surveillance. أحيانا يكون في صعوبة في جمع الداتا وما في أحد يساعدك تجمع المعلومات بطريقة صحيحة لأنه مرهق جدا to collect the data. وأحيانا يكون في shortage of infection control staff, so other medical staff should assist and help, but most of the time or sometimes they are not, so that's a kind of obstacle. Some physicians are concerned about reporting healthcare-associated infection as it may be compromise their reputation. Some surgeons hesitate to report SSI as it might affect their reputation to clinical symptoms sometimes versus surveillance criteria. They have sometimes different matching or relativity. So you cannot decide, is this a criteria of infection, healthcare-associated infection or not, based on the clinical symptoms of the patient or not. So sometimes it's confusing. Also, complex definitions of the surveillance. Actually, the surveillance definitions are complex and it needs a well-trained person to deal with them. Definitions are changing frequently from the national and international guidelines, and that's an obstacle also. And rapid turnover of infection prevention and control staff, it might affect the reality of the surveillance data, right? لأنها كثير تتأثر بفترة انتقال الموظفين أو غياب أحدهم بإجازة مطولة أو whatever. أكيد حتعطيني data not not certain data within this period of turnover or long vacations, etc. Time and effort consuming. Of course, surveillance is a very time and effort consuming project. Thank you very much. Any questions? شكرا يا نوف. في سؤال من الأخ عبد الرحمن I guess إيه يقول أقسام مكافحة العدوى في المنشآت الصحية من يقوم بتقييم عملها؟ هل هي الإدارة العليا للمستشفى أم وزارة الصحة بشكل عام؟ الانفكشن كنترول ديبارتمنت عادة evaluated by outsourcing يعني من برا من لجان الاعتماد let's say سباهي JCI MOH ICA الوقاية والتحكم CCC. هذه الجهات هي المخولة بتقييم قسم مكافحة العدوى. شكرا لكم جميعا. Thank you للي يقولون شكرا. And you're welcome. مش المستشفى نفسه اللي يقيم قسم مكافحة العدوى. قسم مكافحة العدوى لازم يعمل الستاندردز اللي عليه. في ستاندردز للسباهي للآيكا للجي سي آي لكل قسم مكافحة العدوى. لازم مدير الإدارة اللي هو مدير قسم مكافحة العدوى والتيم اللي معه يجهزون القسم على هذا الأساس. التقييم لهم عادة خارجي. عادة يكون خارجي. شكرا جزيلا يعطيكم العافية. Let's move to the last topic. إيش رأيكم؟ I think we have to move to the last topic بدون break so we can finish if you want. تبون break ولا تبون خليني أسألكم. عفوا عفوا تبون break 10 دقايق ولا we move to the final topic؟ نخلص كثير قالوا نخلص ما نحتاج break. اوكي stop share. طيب بسم الله. واضح الشاشة؟ اوكي I will continue. تمام good. طيب last topic today patient safety for better patients outcome. بما أن التوبكس اليوم كلها عن ممارسات لتحسين تجربة المريض. Because that most of the topics today related to the best patient experience and best يعني شو أقول لكم best outcome, patient safety, staff safety. So أكيد نحتاج we have to conclude with a patient safety for better patient outcome topic. And I have chosen the color orange لأن الأسبوع هذا is patient safety world day isn't it؟ صح اليوم العالمي لسلامة المرضى كان الأسبوع هذا ولا؟ أيوة صح. So اللون أورنج كان صح؟ اللون أورنج للبيشنت سيفتي عشان كذا خليت البرزنتيشن بهذا اللون. التوبيك this one is light لطيف and direct. الأوتلاين introduction to surveillance importance and كيف surveillance is impacting patient safety and better outcome and surveillance program outcome in general and of course the controlling measure to reduce healthcare associated infections. لازم نسوي شوي prevention تذكير في نص الليكتشر. لازم we have to come over the controlling measures to reduce healthcare associated infections. And finally infection control سباهي standards related للpatient safety لأنه if we are going to talk about patient safety we should mention سباحي standards. ومين من أكثر شيء طبعا سباحي standard، ولا في أشياء في standards a lot. There are several standards related to أكيد patient safety، بس سباحي is the more comprehensive standards reflecting the patient safety. And في سباحي في standards they call ال ESR. they called ESR اللي هي ال Essential Standards Requirements، وتخص كل قسم ببعض الستاندردز اللي هي should be implemented or very high critical and cannot be accepted without it. So I will discuss those critical standards from سباحي اللي هي ال ESRs فقط، لأن سباحي standards are very long. So we are going to cover only the ESR related للinfection control طبعا. Okay. As an introduction, healthcare-associated infections are associated with significant morbidity and mortality. This is a fact, well-known fact. Assist in avoiding increased length of stay in admitted patients and consequently the cost of healthcare services. Surveillance of healthcare-associated infection provides the policymaker as well as healthcare professionals with infection rates a critical step in healthcare-associated infection prevention strategies. So من هنا بنعرف أهمية ال healthcare associated surveillance في خفض معدلات الوفيات والإقامة الطويلة بالمستشفيات، خفض معدلات الصرف المالي أو الجهد المالي على الرعاية الصحية للمرضى في المنشآت الصحية. بعد إنه مهم في موضوع البوليسي، تحديد البوليسي أو الإجراءات والسياسات من خلال هذا السيرفيلنس اللي العاملين والبروفيشنالز يلتزمون فيها علشان ينزلون معدلات العدوى ويطبقون استراتيجيات المكافحة للأمراض المعدية في المنشآت الصحية. السيرفيلنس فيجن بشكل عام is committed to excellence and safety of healthcare services provided by the hospital through promoting up-to-date infection practices including surveillance. So هذا الفيجن للsurveillance. الmission is committed to provide information that contribute to the delivery of the highest quality healthcare by promoting safety and reducing the risk of acquiring and transmitting infection among patients, visitors, healthcare workers, and supporting staff at hospital through ongoing data collection, consideration, and analysis, followed by the dissemination of guiding information and actions using sound epidemiological and statistical principles. فهذه الميشن للسيرفيلنس تعطي المعلومات وتساهم بالمشاركة بالمعلومات والمشاركات والنشاطات اللي ترفع من جودة الهيلث كير، تمام، وسلامة المريض والزوار والعاملين أيضا، من خلال جمع الداتا المستمر، الاستشارات، التحليل، وبناء عليها ينشرون الجايد لاينز بناء على اللي شافوه من معلومات واكشنز عن طريق استعمال الحس الإحصائي الحيوي مبادئ الإحصاء الحيوي. اوكي. بالنسبة للسيرفيلنس objectives، أعتقد إنه my colleagues ومايا went through this ولأنها طويلة، بس maybe we will, no problem, we'll go through it quickly. الobjectives أو قلنا الميشن والفيجن والobjective to measure the incidence of healthcare associated infections and organisms, establish their endemic rates through using standard definitions. لازم يكون في standard definitions زي ما قلنا standard definition, standard criteria, standard format، هذا جدا مهم. And method to allow benchmarking both local, regional and international، هذا جدا مهم لأنه لما نجمع الداتا بعدين شو أسوي فيها؟ لازم أقارنها بالبنش مارك. البنش مارك مين عندي؟ عندي اللوكال، عندي الناشونال والانترناشونال جايد لاينز. طيب الثريشولد والتارجت والاشياء هذه نجيبها من اللوكال والريجنال والانترناشونال references to investigate and control hospital clusters. هذا جدا مهم. And outbreaks of HIIs and resistance organisms among patients and personnel. برضو هذا من فوائد surveillance. أيضا to maintain and comprehensive data system to monitor, evaluate and implement the necessary actions to ensure a safe and healthy environment for patient, personnel and visitors. Also to monitor antimicrobial susceptibilities and the development of new resistant strain that may pose challenge to the healthcare system في الفيوتشر. يعني زي السيرفيلنس يعطيك خطة استباقية وقائية، يعني يعطيك خطة حالية وقائية واستباقية للثريتس اللي ممكن تكون في الفيوتشر أو المخاطر اللي المستشفى رايح لها مثلا عن طريق الداتا الموجودة معك الآن. تمام. Also to analyze temporal trends and ensure patient safety and appropriate a collection of available resources. استعمل كل الريسورسز علشان تحصل على الداتا حقتك، سواء الميديكال ريكورد، الاي تي سيستم، النيرسينج نوتس، فيزيشن نوتس، اللاب ريبورتس، الراديولوجي اكس رايز الريبورت. كل هذه الريسورسز are collaborative resources are used for collecting the data and helping for analysis, best analysis, to evaluate new products to be used to control infection throughout the hospital. برضو surveillance يساعد because we can compare after we have used, let's say, chlorhexidine for the patient with colonization MRSA, bathing مثلا of this product from this company, does the MRSA rate drops or not in a month, let's say. So it helps also the surveillance in product evaluation and punctuality as well. To ensure compliance with national and international regulations up to date and being with the world. يعني معدلات مهم ان احنا نكون مع الناشونال والانترناشونال معدلات ranges and rates of surveillance and infections to ensure compliance with the requirements of accrediting bodies مثلا including SEPAHI والJCI, right? So to ensure compliance with the requirements, we need to do surveillance because surveillance is a must, is a requirement. And to provide the data and statistical analysis for research and publication. برضو مهمة في research, publication, also the surveillance is important. So at the end of, and from this importance من هذه الميشن والvision all what we have benefits, what we have mentioned, surveillance department is releasing إيش? First, they release quarterly and annual surveillance report. So you can rely on that. Annual surveillance plan, they are releasing it. Also, data quality monitoring. They use a lot of tools to monitor the data quality. Also, data validation by SVT, surveillance validation tool. Also, research publication. They can be using the data from the surveillance program. Moreover, education and training of medical and paramedical staff, as well as infection control personnel and regional coordinators, right? Performance improvement projects like Zero CLABSI initiative in the year 2019 and the CLABSI action plan to decrease CLABSI rate in year 2020-2021. هذا كله released from the surveillance department. Now, what are the control measures to reduce healthcare associated infection? شوية نعمل prevention تذكير, regular field visit and audits to the hospitals in the regions, monitoring the healthcare associated infections, conducting surveillance, antibiotic stewardship program, لازم يكون فعال في الأماكن اللي إحنا نزورها أو نشتغل فيها. Implementing and compliance of the infection control guidelines in healthcare settings. These are controlling measures تخدم surveillance. Also, implementation of standards and transmission-based precautions. Implementation or implementing the care bundle in hospitals. Screening and cohorting the patients with the same infections. Education and training for medical and paramedical staff. Immunization program for the healthcare workers. Also, environmental cleaning and hygiene. كل هذه controlling measure to reduce the healthcare associated infection وبالتالي therefore it can reduce surveillance high rates. Okay. In SEPAHI, infection control in SEPAHI, we have total standards 44, whereas the total substandards are 188. But what we are considering today and going to talk about is the ESR, Essential Standards Requirements, اللي هم اثنين. Two under the infection control department. لأنه we need to enhance the patient safety, right? So patient safety لازم ESR. So the ESR for infection control, number one, there is a designated multidisciplinary committee that provides oversight of the infection control and prevention program. هذا standard is the infection prevention and control committee is chaired by the hospital director or the medical director. زي ما قلنا الhospital leadership support لازم في هذه النقطة. السيرفير here what will check السيرفير SEPAHI surveyor will check the يعتبر هذه النقطة تعتبر infection control activity, it's considered as activity and it's explained as infection prevention control committee. Right? So you can implement this standard by having an infection control committee which is chaired by the hospital director or medical director. Second standard is the membership of the infection prevention and control committee includes representatives from the medical staff, nursing staff, microbiology, operating rooms, CSSD, pharmacy, dietary, housekeeping, infection control staff, and other department as needed, right? Because in the committee, we raise the basic issues and the threatenings or alerts or emergency issues. So الأعضاء متغيرين حسب الحاجة لهم. So the participants will be changed depend on the need of them in this committee. Number three, the Infection Prevention and Control Committee meets on regular basis, at least quarterly. And function of the Infection Prevention Control Committee include but not limited to the following: reviewing the hospital policy procedure للinfection control department, review together, right? Review of the report للhealthcare associated infection that's submitted regularly by the infection prevention, and let the team to give their suggestion and appropriate action and support during the committee. We have to listen from others. What do they think? What is the best option? What is the best solution in this case? How can we decrease this rate? Because the multidisciplinary team aim is that, right? Also revision of the yearly plan submitted by the infection control team and suggestion of addition changes if necessary. لأنه في annual plan risk assessment سنوية للinfection control department, and this should be discussed in the committee. And if there is any suggestion or additional information to be added or additional actions to be added or changes, it should be mentioned there. Evaluates and revises of the continuous basis, the procedure and the mechanisms developed by the infection prevention control team serve established standards and goal. واضحة هذه. Brings to the attention of the infection prevention control team new infection issues. And يعني new issues should be discussed in the committee, right? Arising in different departments, سواء كانت of the hospital, and suggested solution should be suggested. Each member of the committee acts as an advocate of infection control. فكله مسؤولية الجميع. Infection control is مسؤولية الجميع. right in his department كأنه الشخص المسؤول عن الانفكشن في الديبارتمنت اللي هو ماسكها مثلا أو اللي هو يمثلها trying to promote its principles and ensure application of these rules. There are at least one okay standard الثاني facility design and available supplies support isolation precautions or isolation practices. من أهم الأشياء في infection control isolation practices, right? And إيش اللي ممكن enhance and support isolation to be done properly is the facility design and the availability of the supplies. يعني إذا ما عندي negative pressure room وين أودي airborne patient? If I don't have negative pressure room, where shall I place the airborne patient? If I have negative air pressure room and airborne patient, but I don't have enough N95 respirator mask, what's the use of the negative pressure room الحين؟ يعني still there is a gap. So always we need a facility design which supported also with the availability of the supplies. Both things are supporting the isolation precaution. So هذا السكند ESR اللي هو there is at least one negative pressure room isolation in the emergency room and one in the patient care areas. عموما the number of air negative pressure air room according to the ICA 2023 the required number of airborne infection isolation room اللي يسمونها AIIR should be predicted in each hospital based on ايش on the facility risk assessment, right? Or based on the national approved standard that they follow. And this standard, the surveyor, SEP surveyor will consider this as an IC activity, infection control activity, and will focus on observation, document, evidence to see if this standard is met or not. Second, substandard is the infection prevention control team decides the need for more airborne isolation room, depending on the volume of patient in need for airborne isolation admitted to the hospital. And this one considered as a document review and staff interview to check the availability, the really availability of the negative pressure room. The ventilation system serving airborne isolation facilities provides pressure patterns that prevent airborne pathogens from being distributed to the other areas of the hospital. We have to have an evidence that the ventilation system is clearing the airborne pathogens from the air and not circulating them in the hospital. Rooms designed for airborne isolation patients are under negative pressure room. This is a must. Air is exhausted to the outside and is not recirculated unless it is filtered through high efficiency particulate air HEPA filter. There is evidence of daily air exchange monitoring 12 air exchange per hour when a patient is isolated, when the room is used, occupied. Weekly monitor of the air exchange is needed when no patient in the isolation room. And this also, again, it's an infection control activity, staff interview and document evidence need to be seen. The entry of the isolation room is through a work area or anteroom that serves as a site for hand washing, gowning, and storage of personal clothing, gloves, aprons, and masks, and that's considered of observation. This need to be observed by the surveyor. Toilets and shower and hand washing facilities are provided for each isolation room. This should be there and the surveyor should observe it. Transmission-based precaution cards, isolation signs are consistently available on the patient diagnosis and placed on the patient door or a curtain or whatever, and posted in Arabic and English and indicated the type of precaution required. Transmission-based precaution cards, isolation sign are color-coded. نفس اللي موجودة في وزارة الصحة. Just like the one available from the MOH. For isolation, different categories. Let's say, for example, contact precaution. They color-coded with green. whereas the airborne with blue, droplets with red, right? Okay. Transmission-based precaution card isolation should contain short statement and supported with a regular figure, right? So people can understand from the medical field or not. They can understand, they can read both languages, and the PPEs are well mentioned in the posters. Isolation instructions must be highlighted in the transmission-based precaution cards, isolation signs, needed while transporting the patient under transmission-based precaution to other departments, such as pushing the patient to radiology or ER, OR, or let's say to the ward, or let's say if you want to push the patient to any other areas in the hospital, the transmission-based precaution cards should be available with the patient during the transportation. Respiratory high filtration mask اللي هو ال N95 أو ال N99 are used by staff during direct care of patient on airborne precautions بس فقط, and are available on all units likely to admit patients on airborne precautions. And the surveyor will check it as an observation and with the staff interview. The respirator can be reused by the same patient caregiver as per the period specified by the manufacturer and the hospital policy and procedure, of course. In summary, last slide. Surveillance is an effective tool that can be used to improve patient safety. هذه الفكرة, right? Infection prevention and control practices and decrease healthcare associated infections. هذا كله من surveillance, right? It can be a lab أكيد intensive and utilized resources صراحة, ياخذ وقت يحتاج مصادر كثيرة. So a thoughtful approach is needed when developing a surveillance plan. So before you develop any surveillance plan in your institution, you need to have a collaborative thoughts, multidisciplinary team, call for infection control committee and ask the leaders how they can help you in this kind of heavy approach. Basic surveillance can be conducted without a large infrastructure or many resources. The basic can be reached من مثلا lab report, من مثلا critical care. You can start with a critical care and lab report. شوي شوي, then you can maximize the benefit of the surveillance and make it bigger على bigger wise للhospital as you need. Surveillance should start with an infection risk assessment. From where you want to start, there should be an infection risk assessment at the beginning. So from there you can prioritize the surveillance that you need to start with, because when you implement when you start to establish a surveillance program, you need to have a plan, you need to have resources available, you need to have support, you need to educate the staff to understand and train them what you are doing, what you need from them as a part to help to succeed this program, etc. So it needs a lot of effort. So therefore start small and get bigger gradually, and start from the infection risk assessment plan. Surveillance is only truly beneficial متى? When the results are used to inform actions صح? That will make patients safer. Otherwise, the surveillance is useless. Right? Thank you. Thank you. خلصنا يا جماعة. Thank you so much. Do you have any question? I'm happy to share. That's it for today. اللي يسأل يقول خلصنا اليوم خلصنا اليوم صح. That's it for today. الله يعافيكم. Thank you so much. Nice being with you. Hopefully أشوفكم إن شاء الله مرة ثانية. Hopefully I meet you next time. المحاضرة إن شاء الله برسلها للتيم يحطونها لكم في القناة. الله يسعدكم، شكرا يا خالد المالكي، شكرا. شكرا على الدعوات والشكر. nice being with you. إن شاء الله أشوفكم في مؤتمرات جاية. and